Knock, knock. Hi, my name's Kelsey. What's your name?
Hi, Kelsey. My name is Rick.
Hi, I'm going to be your nurse today. I'm going to come and do a history with you, and we're going to do a physical. Want to make sure that it's okay. My teacher's going to be watching this, and it's video. Just want to make sure that's okay with you.
Absolutely.
Okay, I'm going to wash my hands real quick, and then we'll get started. All right, we're going to do the history part first before we do the physical assessment. So,
Okay.
do you know what today's date is?
It is April the 14th.
Okay, and you said your name was Rick. And how old are you?
56.
Okay, and what is your occupation?
Actually, I'm a nurse.
Okay, good deal. And so you appear that your age. How about level of consciousness? I mean, you know where you are. Okay. And no obvious issues with your skin. Everything looks intact. Nutritional status, do you have any eating issues, anything like that?
No, maybe I eat too much.
Okay, don't we all? Any troubles with posture, position, anything, issues that you have with that? Okay.
No.
You don't have any physical deformities that I see. How do you get around normally? Do you normally walk? Do you walk with a cane?
No,
I mean, you
no
don't have
assisted.
any assisted devices?
No.
Okay. And you look like you're in a decent mood today.
Yeah.
Not a bad mood, huh? All right. Any troubles ever with speech? Do you have any issues talking or anything like that?
No.
Okay. What about hearing?
No.
Okay.
No.
Let me know if I'm talking too loud, not enough. And personal hygiene. You look like you're pretty well kept. Don't have any issues taking care of yourself on that end or anything?
No.
Okay. Now we're going to move on to your height and weight.
Okay.
What is your weight?
Right around 200 pounds.
200 pounds. Okay. And how tall are you?
About 5'11".
Okay. So I'm going to calculate your BMI for you. And that puts you at 28, which that's pretty good.
Okay.
And also your waist circumference. Do you know what size your waist is?
We're about a 36, 38.
Okay.
Somewhere
Okay.
between there.
Not a big deal. All right. So I'm going to get started with our physical assessment. The first assessment that I was going to do has to do with your vision. It's called a Snell test. Don't have the actual card for you to read. If I did, I would stand with the card 20 feet in front of you.
Okay.
I would have you read the smallest line that you could, and that would tell us what kind of vision you had, 20/20, 20/15, depending on what line that you read.
Okay.
Also, now I'm going to move on and do a skin fold thickness. I would do that with on the back of your triceps here with some calipers. I would pinch the skin, do the measurements. Then I would take the average of 3 of them, okay? Then I'm going to move on, do your radial pulse. I'm going to check it for 60 seconds. Okay, I'm going to do the other side. Okay, you're about 74.
Okay.
Now I'm going to, and also when I did that, I counted your respirations. You're at about 18, which that's pretty normal. I'm going to take your blood pressure now. Do you have any blood pressure issues or anything?
Not that I know of.
Run in your family?
My dad had hypertension.
Okay. Good. Do you get yours checked
Yes.
quite frequently? Good deal. Okay.
Probably not as often as it should.
You're 130/74.
Okay.
I'm going to move in here. I'm going to check your right side. Does that sound pretty normal to you?
Yeah, it's
or okay.
Very normal.
136/76 on this side. Which that's okay. It's okay to have different ones. The left side is usually higher. Now I'm going to look at your skin. Actually, let me move this over here out of my way real quick. I'm going to go ahead and check your skin on your arms. You're warm to the touch. No cyanosis, pallor, or anything like that. I'm going to check your hands. All right, nails are pink and well trimmed. No diaphoretic or anything like that. Cap refill is normal. Okay, let me just inspect this one. Okay, no issues here. Okay, and one other thing I want to do is take your temperature.
Okay.
And I would use it, but don't tell me to suspend, so I'm not going to do that. And then also want to your pain, or on a scale 1 to 10, or 0 to 10, 10 being the worst, 0 being no pain. How are you feeling today? No pain issues or anything like that? Okay. Also want to test your skin trigger. So I'm going to do that right there. Okay. No tinting or anything. I'm also going to check on your clavicle right here. Okay. No tinting, anything like that. I don't see any lesions, any rashes, scratches, anything like that. So now I'm going to move on to your head. Okay. Just going to examine everything. Don't feel any masses, lumps, any pain or anything like that?
No, not at all.
All right. Now everything is symmetrical. Now I'm going to move down and check your cranial nerve 7. Okay. So I'm going to have you close your eyes and open them. Open and close your mouth. Okay, no issues there, no pain or anything like that? Okay, I'm going to palpate your temporal arteries. The other side, they're both strong and bounding. Okay, I'm going to check your TMJ. Can you open and close your mouth for me? Okay. Any tenderness, anything like that?
No.
Okay. Now I'm going to feel your sinuses. Go ahead and feel right here. Any tenderness, anything like that? No. This time of the year, people's sinuses seem to get to them. Okay. Now I'm going to do, we're going to check some vision on you. I'm going to do what's called a confrontation test. I'm going to stand in front of you. I want to have you put a hand over your eye. And then I'm going to kind of check your peripheral vision is what I'm looking for, okay? So just tell me when you see my finger, and I'm going to kind of do it too so I kind of know where you're standing.
I can see it.
Okay?
I can see it. I can see it.
Okay?
I can see it.
Okay?
I can see it.
All right, let's do that one.
I can see it. 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 I can see it.
Okay. Alrighty, then I want to do your corneal reflex. So first I'm going to use a pen light. I'm going to just look straight at me. Okay, the light is equal and symmetrical in both eyes. Now I'm going to check your pupil reflex. Okay, constrict normally. All right, both of them constrict normally, no issues there. Now I want to do the 6 cardinal positions, just kind of want to check to see how your vision works, okay? So I just want you to follow my finger, okay? Keep your head straight. Okay, no issues there or anything like that?
Not at all.
Okay, now I'm just going to kind of look in your eyes. I'm going to go ahead and put some gloves on, just so I don't get anything in your eyes or anything. I can get them on. How long has it been since your last exam?
Oh, it's
been a while?
Yeah.
Okay. Is that mainly what you're here for today? Just to... All right. I'm just going to, can you take glasses off for me? Sure. Okay. You want me to set them over here on the table?
Oh, no, I'm cool.
Okay, good. I'm just going to look. Your conjunctive looks good. Your sclera is white. Okay, and we'll check the other side. All right. No issues there. Your pupils were reactive. They're intact. Your iris, they are equally distributed with color. You have some brown eyes, huh?
Yep.
Okay. Now I'm going to do an accommodation test. So I'm going to stand here. I want you to look at my finger, and then I want you to look at the wall behind me, and then look at my finger again. Okay? All right, no issues. I am going to...
Can I put you there?
Sure. That's good. I'll get it dark in the room for a minute.
Okay.
Okay, there we go. And I'm just going to kind of check your red reflexes.
Okay.
So just look straight ahead. Okay, everything looks good. Your retinal background, everything looks great. Let me check this one. Okay. All right. Everything's reactive. Everything's symmetrical. So that's good. Now we're going to move on. Turn this off. I'm going to move on to your ears. I'm just going to check and make sure there's no pain or tenderness.
Okay.
Okay. Pulling up, down on your auricle. Okay, nothing there. We'll move to the other side. Okay. No lumps, masses, anything of that nature. I'm going to check the inside of your ear on the external part. Don't see any redness, swelling. Hadn't had any recent ear infections or anything, have you?
No.
Okay. Okay, everything looks good. Tympanic membrane is good. It is oval and it is a pearly gray. I'm going to look over on the other side just to make sure that everything looks the same. All right, everything looks great. It is gray and oval also. No external issues, no pus or anything in the inside or outside of your ears or anything like that, so that looks good. I'm going to do a whisper test, is what we're going to call it.
Okay.
I'm going to stand on this side of you.
Right.
I'm going to have you close your ear on your left side.
Okay.
And then I'm going to whisper something. So if you'll just tell me if you can hear what I'm saying, okay?
ABC.
Okay. Now I'm going to switch to the other side.
ABC.
Okay. Just want to make sure that everything's good on that. I would perform a Renee test if I had a tuning fork. What I would do, I would hit it on my wrist to start the vibration. I would put on the back of your mastoid process till you don't hear the noise anymore. Then I would move it in front of your auricle to make sure that that was okay. I'd do that bilaterally. Then I would also do the Weber test, and I would still use the tuning fork, hit it, put it on the top of your scalp for vibrations to make sure that you hear the vibrations equally, okay?
Okay.
Now I'm going to move on to your nose. Any issues sinus-wise or anything?
I get a little seasonal stuff.
Okay, it looks pretty symmetrical to your face, midline and everything. So I'm just going to have you tilt your head back a little bit. I'm going to look in there, okay? No issues, everything's pink like it should be, turbinates. Everything looks great, okay? Can you close one side of your nostril and sniff for me?
Sure.
Okay, can you do it on the other side for me? Okay, awesome, that is great. So now we're gonna move on to your lips and mouth area. Your lips look fine, they don't look dry, cracked, any problems with air, they look moist. Can you open your mouth for me? Okay, just gonna look in here, can you say ah? Okay, your uvula was fine and raised till midline. Let me look at your tonsils.
Okay.
All right, they are present, no exudate or anything like that. Everything on your buccals look good. No masses, lesions, or patches. Can you lift up your tongue for me so I can see underneath? Okay, perfect. Very vascular, pink and moist. Good. Can you bite together? Okay, good job. And your gums look great. They're pink. Their margins are great. So no issues with that. Now I want to look at the top of your mouth real quick, at your palate, your hard and soft palate. They both look great. Okay, no issues with those. And I'm going to check your cranial nerve 12. Can you stick your tongue out for me? Can you move it side to side? Okay. Now I'm going to take a tongue depressor, and I want you to stick your tongue out, and I want you to push it to one side. All right, and push against me. Ooh. All right, let's do it on the other side. Okay. Now I'm going to check your gag reflexes. So if you'll stick your tongue out. Okay. That looks good to me. Now we're going to go on to your neck. I'm going to go ahead and take these gloves off. Okay. I'm going to palpate to make sure there's no obvious masses, enlarged lymph nodes, anything of that area. Down your clavicle, there's nothing. Okay. I'm going to go to your sternal notch, and I'm going to feel your trachea. Don't feel any issues or anything there. Okay. I'm also going to go to the back, and I'm going to feel your thyroid gland. Can you swallow for me? Okay. Everything felt great there. No issues. I'm going to go ahead and feel for your carotid pulse. I'm going to feel right here for just a minute. Okay, it's strong and bonding. Going to do right here. Okay, no issues there. It's strong and bonding. +2. Now I'm going to flip over and listen with my bell and just make sure that you don't have any bruises or anything, okay?
Okay.
Can you hold your breath for me? Okay, you can go ahead and breathe. One more time, hold your breath. Perfect. All right, no sound is good. Now I'm going to check your cranial nerve 11, and I'm going to come back behind you here, and I'm just going to have you shrug your shoulders against my hands. Okay, great. No issues there. So now I'm going to have you push against my hand. Okay, and then the other side. Okay, good deal. So now we're going to move on to your chest and lungs and all that kind of stuff, okay?
Okay.
When I look at the back, you have a normal curve of 45 degrees, no issues, no skin issues, warm to the touch, no lesions, rashes, breakdown, anything like that. I'm going to check your span of your breathing. So I want you to take a deep breath in. Okay. It moves symmetrical. That's very good. I'm also going to do what they call a tactile fremitus. So I'm going to put my hands on your chest, different areas, all the way down to check your lungs. I just want you to say 99, okay?
Okay.
Go ahead.
99. 99. 99. 99.
Okay.
99.
Okay. And now I'm going to do a little percussion, okay? Okay, that was great. We had a low pitch. It was clear and hollow. Now I'm going to move on. Let me get my stethoscope. I'm going to listen to your, actually I'm going to check your diaphragmatic excursion. So I'm going to have you take a deep breath in, and I want you to exhale, and I'm going to go down your back, okay? Ready? Take a deep breath in. Exhale. Okay, I was listening for the change in the sound. It appeared right here. I'd make a mark on your back. Then I want you to take a deep breath in. And now I want you to exhale. Take one more deep breath in and hold it. Okay, where it changed, my sound changed, I would mark it on your back. I would measure it. The normal is 5, and you are right at 5. Now I'm going to check your kidneys for any kind of tenderness. Do you have any problems, anything like that?
No.
Okay, I'm going to do a little pounding to check for your tenderness. That hurt at all?
No.
Okay. That hurt at all?
No.
Okay. Now I'm going to assess for some of your pulses. I'm going to go ahead and we're going to check your brachial pulse. Okay, it's strong and bounding. Now we're going to go to your radial. Okay, it's strong and bounding. Then we're going to go to your ulnar. Okay, it is strong and bounding. Then I'm going to come here and I'm going to feel for the epictrochlear node. Okay, and I don't feel anything, so if it's not palpable, that's normal. We'll check your brachial pulse. Okay, that's strong and bounding. Radial. Strong and bounding. That's strong and bounding. I'm going to check your node over here. No node is palpable, so that is great. I'm going to go ahead and I'm going to listen to your breath sounds in the back.
Okay.
So just take a couple deep breaths in and out, and I'm just going to listen down your back, okay? No issues there, didn't hear any wheezing, anything like that.
Okay.
Now I'm going to have you do some range of motion on your arms.
Right.
Can you hold your arms out in front of you?
Mm-hmm.
Okay, above your head, to your side. Okay, put them behind your back. Okay, and then across your chest. Okay, I'm going to go ahead and I'm going to have you lay back. I'm going to move this pillow right here. Okay, you can lay back. I'd have your head at 30 degrees. I'm going to check for your jugular vein distension. You don't have any, so that's great. Let me come and look on the other side. Perfect, no distension. That's always a plus. Now I'm going to go ahead and start, I'm going to listen to your heart. Actually, I'm going to actually listen to some lung sounds before I start listening to your heart, okay? Take a deep breath in. Good deal. I'm actually going to do one more thing with your lungs like I did down your back for the tactile fremitus. So I'm going to put my palms on here. I want to say 99 again.
99.
Okay.
99. 99.
Okay. Vibrations were felt equally and bilaterally. Now I'm going to listen to heart sounds. I'm going to have you roll to your left side. I want to see if I can feel your apical pulse, and that's the best way for me to feel it. My arm under here. Okay, perfect. Have you roll back over. I am now going to assess for your vowel sounds. And actually, I want to go back and listen to your heart sounds because I want to listen to with my bell real quick. Okay, I'm going to move on down to your abdomen. Everything looks great. I know you have a shirt on, but normally we'd have it off. Your umbilicus is midline. Everything looks symmetrical. No rashes. Skin is warm to the touch like it should be. And no other issues like that. Right now I'm going to go ahead and I'm going to listen to your vowel sounds. I'm going to listen to all 4 quadrants. I'm going to listen. If I didn't hear any vowel sounds, then I would listen for at least 5 minutes, but hopefully we'll hear some. Okay, vowel sounds are great. They're hypoactive. No high pitched, or they are high pitched, which is good. Now I want to go ahead and I want to feel for all your arteries. I'm gonna actually listen to them, and I'm hoping that I don't hear any of them because that's normal when you don't hear them. Okay. Renal, iliac, and then I'm going to listen to your femoral. Okay, great. Didn't hear anything, so that's a plus on that. While I'm right here, I'm going to go ahead and I'm going to feel for your femoral pulse. It's strong and bounding like it should be. I'm going to go ahead and I'm going to percuss on all 4 quadrants of your abdomen, okay? Just let me know if anything hurts or anything. Okay, perfect. No issues there. I'm going to go ahead and I'm going to do a liver span, which we're going to go with your mid-clavicular line. I am going to percuss down. I'm going to listen for a noise to change, and then I will also come up and listen for a noise to change, okay? So you just lay here and relax. Okay, so I'd make a mark there. Then I'm going to continue going. Okay, and I would measure my marks. Normal would be 6 to 12, and you're at 7, so that's perfect. You're all in there. I'm going to go ahead and I'm going to palpate your spleen. Okay, which is great. I didn't feel anything, so that's normal. You should be able to feel it. I'm also going to go ahead and palpate your liver. Any tenderness, anything like that?
No.
Okay. And I'm going to palpate your kidneys. Any issues, tenderness there? Okay. Other side. Okay. Let's see. I already felt for your femoral artery. So now I'm going to go ahead and I'm going to assess your legs. Do you have any issues with swelling or anything in your feet at the end of the day or maybe in the mornings or anything like that?
No.
Okay, perfect. I'm going to go ahead and I'm going to feel down. Okay, no issues. Okay, everything's normal there. No pitting edema present. Okay, can you feel me touching you everywhere? You don't have any issues with stuff like that? Okay, I'm going to go ahead and I'm going to feel your popliteal pulse. Just behind here, you can just relax. All right, that's +3 and bounding. I'm going to go to your pedal pulse. Okay, perfect. That's +3 in bounding. Perfect. +3 in bounding. I'm going to do it on this other leg. Okay. All right. +3 in bounding everywhere. That's perfect. Toes are all symmetrical. No issues, no ulcers, ulcerations, cuts, cracks, anything like that. Toenails are all well trimmed. Your cap refill is good. All right. And also, can you put your legs straight out? Okay. And you can put them down. Perfect. I'm also going to do some reflexes, okay? If I had my hammer, I would hit you right here, check your reflex here. I would go down to your foot, check them, and then I would go to your Achilles tendon and I would do them there too, okay? And I would do the same thing on the other leg. So I'm going to have you sit up for me, if you don't mind. All right, can you pick your knee up? Okay, how about the other one? Okay, and you already did your legs out for me, so we know that that's no issue. And then we're going to do, I'm going to do a little neurological stuff now, okay? I'm going to take this cotton, I want you to close your eyes. I'm just going to touch you on certain parts. I just want you to tell me where you feel the cotton, okay?
Forehead.
Okay.
Left cheek.
Okay.
On my chin.
Okay.
Right cheek. Forehead.
Okay, perfect. Now I'm going to have you close your eyes.
Okay.
I'm going to have you hold your hand out. I'm going to put an object in your hand. I just want you to tell me what object that is without opening your eyes.
That's a quarter.
Okay, perfect. I hate to have you lay down one more time, but I need you to lay down for me. And I'm going to have you extend this leg out. And we would have you on the bed where it would be supported. I want you to take your heel and run it down your opposite shin for me. Okay, can you do it down the other side? Okay, perfect. I'm going to have you go ahead and I'll help you sit up here. I would also do some reflexes with my hammer. I would do it on your bicep, your tricep, the radial side, your ulnar side, both of them on both sides to make sure that was all good. Then I would, I'm going to have you stand up at this point. Do you have any, you could walk across the room and back, please? Okay. All right. If you could just close your eyes, and I want you to hold your arms down and feet together and just stand there for a minute. I just want to check your balance. Okay. No issues. Can you walk for me again and walk one foot in front of the other in a straight line? Okay, great. Can you walk on your tiptoes? Okay, and what about your heels? Okay, perfect. Can you bend over and touch your toe?
Yes.
Or toes? Perfect. Okay, and then if I'm going to have you sit down, I'm going to do one more test. It's a Babinski test.
Okay.
I just want to make sure that it's negative. We don't want that. So I'm going to start here. Okay, perfect. No reaction, which is great. Okay, perfect. That is awesome. So when you bent over and touched your toes, your spine was great, made a C, which is normal, which it's supposed to do. So I haven't found any major issues. So I'm going to report everything to the doctor for you, and hopefully he'll be in to see you and get you checked out. And I appreciate you letting me check you out today.
All right. Thank
All
you.
right, thank you.